Ho, ho, ho! Merry Christmas! Coming in, Mommy's Little Helper. Day 11 of our 12 Days of Christmas posts and giveaways. So what are we talking about today? Scars. I actually just talked to a patient about this earlier today. So what kinds of scars that moms are experiencing after having their babies? For one, just to orient you here, I'm at the pelvic floor, and basically you can have scars from episiotomy, from natural tearing of the pelvic floor. So I'm looking here, this is the vaginal opening, anal opening, you got your pelvic floor muscles here, the more superficial muscles close to the surface of the skin, those can have some tearing. And the thing with scars is that scar tissue is not going to be as elastic after as it was before. And so this can cause issues. Tearing into this area or the episiotomy can cause issues with, say, intercourse after having a baby. It can change what you're feeling as far as changes in the bowel or bladder function. If you had a C-section, so think about having a C-section scar just above this pubic bone along the lower abdomen. Sometimes they are vertical, but what's right behind this pubic bone? The bladder. What's behind there? The uterus. Okay, we kind of work our way to the rectum. But you can see having a scar here, we see it from the outside, but the thing is that you have to understand is that where is that scar leading to? What is it grabbing a hold of? What is it creating kind of a straitjacket of restriction around? It could be into the ovaries. It could be causing some issues in reproductive health, right? It can cause, I've seen women after having babies that never had pain or a lot of pain with menstruation. Their menstrual cycles are having extreme pain after having babies, to the point where they don't want their period. Who does? But I mean, to the point where they actually dread it and makes them miss work and that kind of thing. It can be causing, scars can cause issues into the lower back, pain years later, okay? And certainly can be causing things like incontinence or urgency, frequency, things like that, where the bladder is not able to fill like it needs to. Irritation up at the urethra, especially if you had any type of scarring into the, or tearing along the labia. It can affect ability to orgasm. It can affect that clitoral tissue as well. So anyway, that's what I wanted to talk today about scars, because a lot of moms don't realize that their scars may be causing a lot of their issues postpartum after having babies, okay? I just want to make sure, oh, the other thing is if you had like a forceps birth, if you had more of that traumatic birth, and maybe you had some scarring deeper into the pelvic floor. So these are things that pelvic floor physical therapists like myself can look at and can help you through very gently releasing these scars and giving you some really good information. What I want to give you today is my free pelvic floor course. It's a mini course. It's an introductory course on checking your own pelvic floor. It's exactly what I teach my patients. You can grab this online in quick 10 minutes a day. It's a 5-day mini course. You can learn about scarring and some other great things postpartum related. Okay, so check out the link in my bio or related to this post and go get it. It's free. It's going to give you a lot of information. And please, please, please tag a mom. I hear just about every day from my patients that say, I wish I would have known this information. Okay, thanks for watching. I'll see you for the final day tomorrow.